Welcome, everyone. If you're gearing up for your pediatric ATI exam, then you are in exactly the right place. We're about to do a high-yield blitz through the immune and infectious disorders you absolutely have to know.
So think of this as your rapid-fire cram session. We're going to lock in those key facts, the ones that always seem to show up, so you can walk into that exam feeling totally prepared. Over the next few minutes, we're hitting 4 super important chapters straight from your ATI book: Immunizations, Communicable Diseases, Acute Otitis Media, or AOM, and of course, HIV. So let's just dive right in.
Okay, kicking things off with immunizations. This stuff is so fundamental to peds nursing, it's pretty much a guarantee you're going to see it on your test.
For test day, you've absolutely got to have the 2, 4, and 6 month schedule down cold. But look, don't just memorize it. Notice the pattern. A lot of the same vaccines like DTaP, rotavirus, polio, Hib, and PCV are repeated. That repetition is exactly how we build up that robust early immunity for these little guys.
Now, this slide is super important because it gets into the difference between a real contraindication and just a precaution. And let me tell you, this is a classic ATI select all that apply trap. Just remember, live vaccines are a total no-go for severely immunocompromised kids. Their bodies just can't handle it. But a common cold, a little low-grade fever, that is not a reason to hold a vaccine. They want to see that you can make that safe clinical call. And here we have the principle of atraumatic care. It is so much more than just giving a shot, right? It's about minimizing the entire stressful experience for both the kiddo and the parent. Little things, like sucrose on a pacifier or using a therapeutic hug, can change the entire dynamic of the visit.
Okay, let's switch gears to communicable diseases. For the ATI, you don't need to memorize every single tiny detail. The real key is recognizing patterns, which precautions to use and what the classic hallmark signs are.
So this table right here, this is your high-yield cheat sheet. Knowing that varicella and measles are airborne is a massive safety point. Why? Because those viruses can literally just hang in the air for hours, creating a huge risk in a hospital. And then you have those telltale signs, like that unmistakable whoop sound with pertussis, or those swollen glands with mumps. Connecting those dots is exactly how you're going to score points.
All right, let's pivot now and focus on 2 very different but very critical pediatric conditions. We're going to talk about something super common, acute otitis media, and then get into the complexities of HIV.
So here's the deal. You have to know the difference between a real infection and just fluid. AOM, the acute one, that's an active infection. Think red, bulging, painful. That's going to get antibiotics. But OME, with effusion, that's just fluid chilling behind the eardrum. It often looks kind of orange. That one, we typically just watch and wait. Telling them apart is crucial. This is one of those skills you just have to know for your exam and for real life. It's all about getting a straight shot to see the eardrum. For the little ones, anyone under 3, you pull the pin down and back. For the bigger kids over 3, it's up and back. A good way to remember it? D for down in the little ones. As nurses, our role in patient education is just huge, especially with something like AOM. We have to drill it into parents' heads, finish the entire course of antibiotics, even if the kid feels better. And then simple tips like feeding the baby upright and avoiding secondhand smoke can make a massive difference in preventing it from coming back.
Okay, this is a really vital point for pediatric HIV. For an infant under 18 months, mom's antibodies are still hanging around in their system. So a standard antibody test, like an ELISA, it's going to come back as a false positive. We can't look for the antibody. We have to look for the virus itself, and we do that with a PCR and a virus culture.
Being able to recognize these signs helps you understand just how far the disease has progressed. So mild symptoms, that's category A. You might see things like swollen lymph nodes or some thrush. But when you start seeing things from category C, like pneumocystis pneumonia or wasting syndrome, you know that child's immune system is severely compromised. So when it comes to ART, or antiretroviral therapy, the most crucial part of patient education is managing expectations. This is not a cure. What these amazing medications do is suppress the virus. They stop it from making copies of itself. And that's why sticking to that lifelong medication schedule is completely 100% non-negotiable for a good outcome.
Okay, let's wrap this all up. I want to leave you with one final thought that should really guide you not just for this test, but in your practice too.
Just think about it for a second. Across everything we just covered, every single topic, what's the one thing we do as nurses that empowers families, that keeps kids safe, and that improves outcomes every single time? That's it. It's education. Whether you're explaining a vaccine schedule, teaching hand hygiene, or helping a family navigate a lifelong illness like HIV, your ability to teach, to explain, and to support them is the thread that ties it all together. That really is the heart of pediatric nursing. You totally got this. Good luck on your exam.